Hello and welcome to the first of a three-part docu-series to assess and to just look at the response of COVID-19 in Nigeria. With over 165 cases in the country today, since the first case was reported in February 2020, can we say that the response has been successful? And what can we do to build back better? Today, the United Nations Development Programme, the European Union, the federal government, and your multiple award-winning station Channels Television beams the spotlight on the One UN Basket Fund. Now, that fund is a unified UN strategy aimed at strengthening the response efforts to the pandemic through critical collaboration among the government, humanitarian and development partners, and, of course, the private sector. So welcome, everyone. I'm Ijoma Onyato. With me is my colleague in Abuja, Makwe Ogun-Yusuf. Makwe?
Hello, Ijoma, and thank you for the introduction. Indeed, we are in for an all-inclusive dialogue with a studio and virtual audience here in Abuja and in Lagos, as well as distinguished panelists that cut across government, development partners, and the private sector. It promises to be a very frank and fruitful conversation around multi-sectoral interventions and the critical collaboration that has led to a successful response in Nigeria. We will also examine what needs to be done to ensure that we do not reverse the gains. Ijoma.
Thanks a lot, Mark. Well, indeed, it does promises to be that. But before we get into that conversation, let's just take a quick look at the One UN Basket Fund that has strengthened Nigeria's response across the country. Now, looking at it, there are a number of development partners. We sometimes call them the UN family. So you have the UNDP, UNICEF, you have UN Women as well, UNAIDS, and a number of other development partners within that space that have actually contributed to the fund. The EU is also a very big donor there, the World Health Organization, and of course the Aliko Dangote Foundation as well. Now, beyond just putting money into the fund, let's just take a look at some of what the figures are. So, for instance, for the United Nations, you have over $2 million being contributed into that particular fund. And as the program progresses, we'll tell you just how that money has been channeled and what the various things the partners have done to be able to ensure that the response has been as successful as they tell us that it has been. Looking at the European Union now, their contribution being over $54 million. But specifically, we heard over the last 1 week or so, about 2.2 billion euros, that is, has been moved towards the COVAX vaccination drive. Here in Nigeria, we've seen over about 4 million doses being given. So sometimes when you hear the money, you wonder, where has it gone? How is it channeled across the different aspects of this pandemic, and where did it really go into? Also, the Aliko Dangote Foundation, we see their contribution there being over $3 million, and the contribution as well of the Bill and Melinda Gates Foundation being about $1 million. Now, it's not just about money and specific figures. There are also other things that the development sector partners have done. So, for instance, we look at the NCDC, and we do have the Director General with us today, who's going to answer a number of questions and just put people's minds at rest and at ease to look at where it's going. There's been a lot of technical assistance to the NCDC. That assistance has gone towards contact tracing. I mean, some of it has gone towards looking at funds for quarantine, isolation, and just various aspects of what the NCDC has had to do. And looking at UNICEF, UNICEF in particular was able to help procure 98,225 COBAS tests. Now, testing was the lingo last year, and there was so much discussion about not enough tests being done and what is the testing capacity. And so we found a lot of donor agencies and a lot of humanitarian partners rushing in to be of assistance there. Don't forget the World Health Organization as well, supporting data transmission. About 51% of states now are able to transmit data to the national headquarters. I mean, beginning from 2 to about 5 test centers at the start. I mean, that has actually gone towards that particular direction. Now, looking again to, let's take another particular one, the UN Women, for instance. At the time last year, there was another conversation about gender-based violence, etc., being a pandemic within a pandemic. The UN Women also were able to make a contribution there, where 70% of cash transfer beneficiaries were identified at that particular spot. And even if you look at the UNFPA, in terms of training, they had trained about 855 healthcare and social workers. Now, that was also an issue, looking at how this pandemic just came upon us, and a lot of training needed to be done. So many of the partners were able to key in and assist in that particular regard. Looking at UNICEF as well, training over 45.4 million people were reached in terms of messaging, protocols, how safe is it, what should you do, how should you wash your hands, and all those messages that you saw. Particular groups were behind all the things that you saw, and that's particularly what we're trying to look at this town hall today. Now, before we get into it and the conversation, let's just look at some of the primary healthcare centers where the UNFPA distributed PPEs. We did see some of our healthcare professionals up in arms sometime last year, saying that they needed to be protected if they were supposed to protect us. And when you look at states like Sokoto, you look at Borno State, Gombe as well. Same for the FCT here in Lagos as well. A lot of PPEs were distributed within those primary healthcare facilities just to give our healthcare providers a bit of comfort and a bit of ease to look after us as they were trying to look after themselves as well. Now, that's not the whole story. We actually did a bit of a background check to say it's been 1 year since February last year. Well, a year and a bit now since we're in June. How far has this response been? And let's look at the different areas, the different partners, and the different people. So I'm going to swing this over now to our correspondent, Mary Alala Yusuf. Let's take a look at what she discovered, what she found, and then we'll dig deeper into the conversation.
The impact of the coronavirus pandemic was so far-reaching in such a short space of time that most were convinced it would eventually dominate the global scene. More than a year in, nations are still battling to bring infections under control. The global count of COVID-19 infections has exceeded 170 million, and new infections are recorded daily. In Nigeria, from a single case imported from Italy on February the 27th, the numbers have exceeded 166,000, and the country, like so many others, is experiencing a second wave of infections. There were 5 labs all around the country that could isolate and identify COVID-19. This was possible because of the exposure in 2014 to Ebola.
We started an incredible expansion of laboratory capacity in Nigeria. We're now at 120 labs, about 70 in the public sector, the rest in the private and corporate sector. So I think one of the collateral benefits of this response has been the expansion of laboratory capacity in Nigeria.
By mid-April and early in Nigeria's outbreak, when confirmed cases in the country were less than 400, the European Union donated a whopping sum of 50 million euros to Nigeria for its fight against COVID-19.
And we reached out to the United Nations as well and said, you know, this is an opportunity to see multilateralism in practice. So let's put all our efforts together, let's pool it, and really, you know, step up to the challenge this time.
At the end of March, due to community spread, a lockdown was imposed in Lagos, Ogun State and the FCT. All schools, airports and public places were closed. Schooling ground to a halt for some, others took it online. Many businesses collapsed. Government responded with distribution of relief packages to cushion the effect of the pandemic. Some business owners became creative to stay afloat. Mrs. Tonya Lawani has been in the hospitality business for 15 years. Hers is one of the companies that took a hit from lost opportunities during the lockdown. Mrs. Lawani sent her workers home as was required of lockdown rules. It was a perplexing time. Then she had an idea.
We had a training years ago, over a decade ago actually, and we were trained for sanitizer production.
She used existing production lines to make sanitizers to be distributed at no charge to people who couldn't afford them. But even people with money came because sanitizers were sold out. Then the unexpected happened.
Sanitizers got to a pharmaceutical company and they loved. And then they called to say they saw our product and, they liked it and do we produce, can we work with them to produce, can we contract manufacture for them? At this point, we ventured into sanitizer production, and this is what we have this is a new product we have added to our products, the alcohol-based hand sanitizers, disinfectant surface spray, which is alcohol-based as well, disinfectant hand wash. So all those products birthed from the pandemic.
Not everyone weathered the period quite as well. Business is booming at the Murtala Mohammed Airport as newly disembarked passengers look for taxis to their various destinations. This is in stark contrast to late March of 2020, when most air traffic was stopped to control the spread of the novel coronavirus, which was assuming alarming proportions.
We'll start calling each other that if you are buoyant, please try and help others.
Plans to disburse monies to less fortunate cab operators through the association's purse fell through because multiple signatories living in different parts of the state were constrained by lockdown rules and banks were shut down. That's where food packs, bought with monies provided by a private sector-led organization in Nigeria, CACOVID, and international bodies came in handy to reduce hardship.
Funds we are giving to women affected by COVID-19 and also to vulnerable groups, in partnership with the banking system and the National Social Safety Net coordinating office.
It soon became clear that regular hospitals could not contain the growing number of infected patients, especially with the need to isolate them from others. Public buildings were cleared out to serve as isolation centers. Some tents were also hastily erected by the government and the coalition against COVID-19 to house the infected away from others. Curiously, the pandemic is not as devastating in Nigeria as in Europe and the Americas, though rules of physical distancing, mask wearing and hand washing are regularly ignored. The cost of managing the pandemic in Nigeria has been enormous. The budget allocation for health in 2020 came to about 427 billion naira. Effort for the COVID-19 response came mostly from special funds and the private sector. It took the combined effort of the federal government, development partners and the private sector to wrestle the virus to submission.
Pandemics affects everybody. So nobody is safe, as they say, until everybody is safe. So the UN family were able to get together and support the country, and we're pleased to see a year later Nigeria has done much better than anybody expected.
Donations towards the fight against COVID-19 from the UN Basket Fund, the Coalition Against COVID-19 and government have run into tens of billions of naira. The US government donated 200 ventilators and 50 came from the Basket Fund, which also provided an initial $2 million for the procurement of essential medical supplies.
We were able to get further resources from Canada, Norway, Switzerland, Gates Foundation, MacArthur Foundation, Dangote Foundation. Overall, we were able to raise about $73 million.
We procured about 10,839,000 PPEs. And those were comprising 459,783 test kits. We brought in 50 ventilators. We brought in oxygen concentrators. We brought in resuscitators. We brought in swab collections and extraction kits. We brought in gowns, gloves, face masks, and face shields, etc.
Infections peaked in July 2020. Then the daily numbers started to decline, giving hope that it would soon burn out. Those hopes were dashed when cases were on the rise again by October. The Presidential Steering Committee attributed this to the fallout of mass gatherings like the EndSARS protests, and daily infections in November surpassed those in July. The second wave had begun. Something else that distinguished the second wave from the first is the emergence of vaccines from several foreign companies. The concept of vaccine equity birthed the COVAX facility with the aim of getting vaccines to lower-income countries at no cost to them. On March the 2nd, 2021, Nigeria took delivery of 3.94 million doses of the Oxford AstraZeneca vaccine via the COVAX facility.
Vaccine is an important tool, an important addition, so it was important to add that tool to the arsenal that was already in place in Nigeria.
The struggle to understand the new virus put pressure on researchers and research institutes, and Nigeria was the first to sequence the novel coronavirus genome. Experts say outbreaks would happen from time to time, so preparedness should be the watchword. And beyond that, collaboration is important for countries to move forward together.
Nigeria should continue to rely on the UN and other partners if the country is to effectively control the pandemic.
It's vital that you combine having not only development cooperation funding made available for specific projects, but actually have a real political framing of that. And the only way to do that is working, in support of Nigerian-led visions.
We need a strong National Public Health Institute with the resources, the capacity, the knowledge, the expertise to continue protecting the health of Nigerians.
Apart from increasing funding to the sector, experts suggest that the government should give tax waivers and incentives to healthcare-based programs, make health insurance work, and pay more attention to research and technological solutions to rebuild and strengthen the health sector. Only collaboration of the government with the coalition against COVID-19, humanitarian and development partners, like the combination of the UN country teams, has resulted in timely control of the COVID-19 situation. How Nigeria fares during the rest of the pandemic will depend on how creatively she employs these pooled efforts.
All right, quite a bit to consider there, but at the heart of it is the collaborative strategy that sits right at the heart of the One UN Basket Fund. We're going to take a look at what those building blocks entail, just as Mary has shared with us. But let's get into the conversation now. And joining me on the program is the Commissioner for Health, Ogun State, Dr. Tomi Koka. Thanks a lot for joining us on the program.
Good afternoon.
Thank you for joining us. But I'll just ask you to pause for a minute while I swing this back to Abuja, because I have Makwe Ogun Yusuf there in Abuja. And Makwe, just lead us off with the guest that you have there.
Well, thank you, Ijoma. Here we have with us Dr. Chikwe Ihekwazu, who is the Director General of the Nigerian Center for Disease Control. You're welcome to the program.
Thank you, Mape.
We also have with us Dr. Mohamed Yahya, who is the resident representative of the United Nations Development Program. You're also welcome.
Thank you for having me.
Well, quite a lot to chew on there from the report done by our correspondent Mary Alale Yusuf. However, when the first case of the novel coronavirus was announced in Nigeria in February 2020, at that time, it had not been declared a pandemic by the World Health Organization. How big a threat did we think that was going to be to Nigeria before it landed here?
So thanks, Marpa. Before the first case, before we found that first case, remember there were a couple of what I call near misses. So we had a number of cases already who had a significant travel history, symptoms, who were tested. So we had kind of, we knew this was going to come. So there's a threat evolving in China, early cases growing in Europe, travel was still happening. So we were aware of the risks. We tried to make sure we were able to detect the risk when it came. And so I still remember the first night when we found that first case, and in contact with both Professor Bayomi, who was the commissioner in Lagos, and Dr. Coker, the commissioner in Ogun State, and their teams and the various other people involved in that response. So, you know, at that time, to be honest, the thinking was still that, yes, there was an incident. No one thought it would grow into a pandemic. And we were fairly confident at the time that with the trajectory in China, remember the China epidemic had gone up a bit, they managed it, it had come down. At that time, I think we were a bit not really aware of how much transmission had already happened in Europe and the US, where most of our first cases came from. So looking back now, 1.5 years later, and where we are, it's really over 3 million deaths around the world. It's just an incredible part of, you know, the past, you know, our lifetimes, and a lot to reflect on, really, and really a lot to learn from in that first instance.
I know that we're a bit jittery about the state of our own healthcare system here, and we were wondering how we were going to cope should such a disease come into Nigeria. But with the benefit of hindsight, how would you say that we responded? Especially through your organization, the NCDC, you had the responsibility to control such novel diseases coming into Nigeria. How would you say that we fared, and what would you have done differently?
You know, every time I spoke in public in the years preceding early last year, there was a slide I always started with, a cover of Time magazine saying that the world was not prepared for the next pandemic, whenever it were to come. But I think even as I used that slide, most people never really thought it would happen. And of course, I hoped it would not happen, right? But I knew from the day I walked into this job in August 2016 that we hadn't built up the infrastructure that we needed. But we started. But it still needed a lot of convincing for people to realize, listen, this was a threat, because, you know, viruses you can't see the threat. So with the benefit of hindsight and what we have to do now, we definitely didn't have the public health infrastructure to manage a pandemic this size, or to even mitigate its impact as much as we should be able to. And I'm hoping that we will learn lessons. But we did the best with what we had, grew rapidly, expanded as quickly as we could have, and benefited from the investments we made from 2016 to the beginning of last year. And we had already in our workforce people that had responded to Lassa fever outbreaks, to meningitis outbreaks, that we could then deploy for this. And they then started what has been 1.5 years of consistent response to the biggest threats to health in our lifetimes.
Well, Dr. Yaya, for you, when you look at the response of I don't know what the thinking was within the United Nations Development Fund, you're the resident here. Beg your pardon, I think that's the UNDP, that's the program, not the fund. What were some of the critical initiatives that your organization had to come up with, knowing that you were in a country that had very fragile healthcare system?
Thank you. It's always good to remind ourselves, when it came, you heard from Dr. Chikwe in terms of the infrastructure the state had and how to respond. It's always good to also remember, politically in the global system, you had a move away from multilateralism, essentially something that is opposite to dealing with pandemics. So if you look at the political climate, it was a very difficult political climate. Combined with, if you come to Nigeria, you had a health system that was very limited in terms of investment overall. You had a social structures and economic structures that are heavily reliant on informality. People live very close to each other. African cultures are one where you live in extended families. And then you looked at the issue of the country's economy, heavily reliant on oil, which meant reliant on a global economic system. All that, from our perspective, was a perfect storm of a potential disaster in the country. And then we looked at documents that were coming out from well-respected institutions globally, and projecting a death rate for Nigerians between 200 to 400,000. So we were all very nervous. So what we did early on was to go and look at our multilateral angle. Essentially, the UN was set up for this kind of problems, where countries by themselves cannot address a challenge. How do we bring the system, how do we bring our partners? So the first thing we did from our side was to be able to create, to look at how we can backstop Dr. Chikwe and his team, the government, provide the technical needs that were available to us through our specialized agency, but also go to partners such as the European Union and others to say, how can we work together to be able to support the country?
Well, no one would have seen you working behind the scenes, but I'm sure that you were very relieved when you saw the presidential task force being formed.
Absolutely, and that is one of the, and I think when this story is told, hopefully once we are not there yet, Dr. Chikwe always reminds us we have not defeated COVID. When the story is written of COVID, I think one of the things that people will celebrate was the vision of creating the presidential task force, bringing all the government approach to deal with this, bringing the governors in. I think that played an important role in the success of Nigeria so far.
So for you, what would you say are some of the key lessons that we can take away even as we move forward? Because as you rightly pointed out, the virus isn't yet defeated, and who knows what we'll have to face in future.
If I had to think about a brief way of explaining that key lessons, one is that health is both an economic imperative, health is a security imperative, and healthy nation and institutions, health institutions that are not strong exposes the country to much bigger threats, and we've seen that already globally and also here in Nigeria. So health, that would be my lesson.
Health is wealth.
Exactly.
I guess. Well, Ijoma, it's over to you now.
Indeed. Thanks a lot for that, Mark. But now, just listening to that conversation, I am going to take up the DG of the NCDC on a number of points, but it's very interesting what you're saying now, and it's important that we do hear also from the Ogun State Commissioner for Health. I mean, looking at the proximity of Lagos to Ogun and the way the borders are, let me just ask her quickly now, what initiatives were critical for you? What partnerships were you able to leverage on 1.5 years later, if we can put it like that?
Thank you very much. At the inception of the outbreak, being that the first case was detected in Ogun State, but Lagos State was the designated NCDC testing center, he was transferred to the isolation center. We quickly recognized that we needed to build our own capacity for testing in the state, and NCDC came alongside us to establish our own lab, and we now have 2 state labs with the support of NCDC. The other thing they did was build the capacity, human capacity, because we had an existing emergency operations center that was moribund, but within sort of 24 hours of the first case being confirmed, we have personnel from NCDC, WHO arrive in Ogun State. Lagos State, we found we had to collaborate with, because we found that our hotspots were around the communities where they were bordering Lagos State. So we worked together in actually formulating guidelines and policies and on our testing. And when there was the restriction, the lockdown, because Lagos, Ogun State and FCT were the states that were locked down, there was no lockdown between the 2 states. There was just free movement. People totally ignored it. So we had to work as a unit rather than 2 different states to try and curtail and contain the spread of the virus in the community around us. So those collaborations were very, very much important to us. We also had our international partners who had come along, invested in us. WHO gave some support. We had the private sector, which was very, very key. We had the Coalition Against COVID-19. They supported us with much needed medical equipment, and also we had philanthropists, because Ogun State is the industrial hub of Nigeria. We had companies such as large organizations coming to donate ambulances, all the things that we needed. Because having been locked down, the economy of the state was impacted upon. So funding those essential things became a challenge for the state. But we had the central support, the national level and the local level from the private sector. So those were our key collaborations. But I must point out that the religious, because of our location as a state, our unique location, we had international borders. And we had Nigerians who were in other countries coming in through the border with Benin Republic. So we still had to deal with immigrations and allowing Nigerian citizens come back. But there's a trade route between Osun and some West African countries. We had about 3-4 bus loads of individuals, particularly mothers and children, arrive at 2 a.m. at our border. And we had to think about their safeguarding and guiding them through Ogun State, getting permission from Port Health Authority and the immigrations in Abuja to actually get them through the border and escort them to Osun where they were going. And about 20% of those turned out being positive for COVID. And Osun had to deal with that. So the governor at his level was dealing with, liaising with the governor in Osun. I was liaising with Abuja. So there were multi-layer collaborations that were not obvious to the general public at the time. But ultimately, it led to a well-curtailed and contained response to the outbreak.
Okay, that's on one level. Now, looking at messaging, for instance, many months later, I know the DG of the NCDC talked about having to convince people and, let people know that protocols were important, to keep the protocols, for example. But I was looking at the Africa CDC report, looking at vaccine perception and would people take a vaccine if they had to. And why I'm asking is because even here in Nigeria, about 60% of them would say that the messaging on COVID-19 is exaggerated. And perhaps do they really believe that it's as bad as they are hearing? Do you still have that problem in the state, people actually believing that they still do need to wear a face mask and they still do need to take this as seriously as they did in February 2020?
Thank you for that question. You are absolutely right about the public not actually adhering to the non-pharmacological interventions, not wearing their masks. And we have a task force out there to try and actually hold people responsible. And we continue to send messages out. People in Ogun State, the vaccine rollout has been very, very well received, as we actually did our first phase, the first dose, within 9 days. And we still had people coming that we actually had 2 other top-ups. So we haven't faced that challenge. As it stands, we've actually vaccinated over 80,000 for their first dose, which is more than 1.5, around about 1.5% of our population. And the target was to do 1%. So we've had that, the public have been receptive, but complying with the non-pharmacological interventions has been a great challenge. We keep sensitizing and informing them that we have not got over COVID yet. We still have to wear our mask even after having the first dose until we have that herd immunity, which we do know that it has to be about 70% of the population. It still remains a challenge which we have to address nationally, because it's not just Ogun State. We see it everywhere we go.
All right, Honorable Commissioner Dr. Tomi Koka, I'm going to thank you for your contributions, but do not go away, because obviously there's still going to be 1 or 2 questions that might come your way, but just to thank you at this point. Now, I did promise that I was going to speak with the DG of the NCDC just to ask him very quickly, Mark, from your end, that there is the talk of the Indian variant and there is the talk about us being careful in case of a situation where there could be a 3rd wave. Now, I heard you say that we've done the best that we can with what you had to work with and with what the partners have done. But if there is another wave, what would you do differently?
So, thank you, Ijoma. I think we're working on the assumption that there will be, and we hope there won't, and we're doing everything possible to avoid it. Now, what are we doing is continuously speaking to people. You know, a third wave is not inevitable. It's up to us, really, to mitigate the impact of this and ensure as much as possible that it doesn't happen, which is why the Presidential Steering Committee made a very difficult decision a few weeks ago to limit travel from a few countries that were having a spike of infections, therefore trying to prevent the entry of these new variants into the country. But we still have to do our bit here. What are we doing? We're trying to encourage everyone that has access to the vaccines to take up those vaccines. We've done very well in doing that. But there are things that are in our hands. You know, from the beginning of this response, it's been clear to us that this is not a response that we, government, or even our partners can deal with on our own. We really needed the Nigerian people involved in the response, taking ownership, taking responsibility, which was the theme of a campaign that we've run throughout the response. And that's what we kind of continue to need Nigerians to do. We have a very fragile success at the moment. We're trying to hold on to those gains, and it's really in our hands to try very hard to continue doing some of the very difficult things we've been talking about for the past 1.5 years around distancing, masks, washing our hands. It's what we can do while government is doing everything possible to get in the vaccines that we need. Listen, if we mitigate, if we manage the situation the best we can, a new variant emerging depends really on the intensity of transmission, either in Nigeria or in other parts of the world, because we all travel and connect with each other. So the more we can limit transmission, the more we can limit the ability of new variants to emerge and cause more harm. But having said that, what we're also doing is, should all of this fail, and we do have an increase in cases, working very hard to learn lessons from countries like India, to make sure we have oxygen supplies, continue expanding our lab capacity, our care capacity, and really to be sure that whether it's this outbreak or any other similar outbreak in the future, that we at least have the facilities to provide care for our citizens as we work hard to learn very quickly in order to, join the race towards developing vaccines, which is really where we want to be as a country. We want to be participants in the science, in the innovation, in the thinking around the response to infectious diseases, not just recipients of care and donations, which is why a lot of the partnerships that have evolved from the response with the UN, with the private sector through COVID, yes, came out of the response, but our goal is to really move with this to develop much longer lasting partnerships to make Nigeria a much stronger country in the fight against the threat of both COVID and other infectious diseases.
Okay, so let me quickly come to you then. When you look at the fact that fear, anxiety, and maybe uncertainty might have, also helped. Yes, I know you did a lot of work trying to get all the partners together and also offering that expertise of the United Nations in circumstances like this. However, with donor fatigue beginning to set in and a lot of people just beginning to think that coronavirus might be over, assuming we have a third wave, what new strategies do you think that you're going to be adopting this time around?
Well, first is in the first stage, when the corona started here, the biggest problem wasn't about resources, it was access. I remember talking to Dr. Chikwe many times, and the discussion was that even the government has allocated resources, but we don't have access to actually procure these things. It's the same thing with the vaccine now. It's not only about money, it's about availability. So one thing the UN has been able to do, for example, in UNDP, we're able to call our China office. We have an office in China and use them to essentially procure and jump Nigeria to the front in securing urgently needed test kits, masks, all the other equipments that were needed. So that's the kind of thing that the UN has been able to do. But we won't be able to do that. As you know, the UN does not print money. Governments print money. So we rely a lot on partners who are able to support us financially, such as the EU and many others, including Nigerian private sector. We think that Nigeria now is in a better situation. I mean, Dr. Chikwe always mentions this. You started with 4 labs, the ability of testing PCR for the COVID. Now you have more than 100, I think, private and public. So Nigeria is in a better shape to be able to deal with a third wave. That does not mean that this is not to encourage people to forget and give away their masks and all the non-pharmaceutical agenda. But what it says is that we feel that Nigeria is better. I think Nigeria will need less international support for any future third waves. Hopefully it doesn't happen. But again, we don't need to test it. We can avoid it. And the best way to do that is when you have a vaccine, take it. And when you don't have vaccines, while we're waiting for vaccines, use non-pharmaceutical approaches.
Well, we'll take a break at this point. When we come back, we'll definitely continue the conversation and then wrap it up. Please stay with us.
Humanity has remained under the burden of coronavirus pandemic, an unseen but very potent enemy around the world. Infection from the virus has resulted in over 2,500,000 fatalities and destroyed several global and national systems. The response in Nigeria and ECOWAS sub-region has been robust, collaborative, and united. It was driven by a collective knowledge of the fact that no country is safe until every country is safe. The speedy development of the coronavirus vaccines is quite significant and underscores the collective resolve of humanity to overcome the pandemic. Similarly, the collaborative effort to ensure equal access has brought relief to poor and developing countries. I have been assured by the Presidential Task Force that the AstraZeneca vaccine, which Nigeria has accessed, will arrive in batches, beginning with the first batch of about 4 million doses already received. I am similarly aware of the rollout and administration plan to cater for over 70% of our population between the year 2021 and 2022.
Welcome back. You're watching Reflections on Nigeria's COVID-19 response, coming to you live from our channel's television studios in Abuja and Lagos. You can follow the conversation on our Instagram and Facebook platforms and let us have your take as well. The hashtags are Build Back Better and hashtag Beating COVID. Well, I guess we'll just have one more question for you gentlemen, and then we'll have to wrap this conversation up. You have said that we're not going to need, you think that we're better prepared, assuming there should be a third wave. But when you look at the response of India, and anyone will tell you that India is almost the medical center of the world these days, and how they're struggling with the third wave of the virus in their country. How optimistic are you, really, especially when you look at how it was seen the Nigerians have gone back? It's now business as usual. How optimistic are you that the Nigerian populace is better prepared, assuming there should be a third wave?
Well, at least people know more what they need to do. I think the government and NGOs and civil society have done a fantastic job in telling people what we need to do. Wear a mask, wash your hands, socially don't go into huge crowds. So we know what we need to do, what they call non-pharmaceutical approaches. The testing capacity is better. You mean, I remember when it took 2-3 days to get your results, now it's much faster. So the systems are there, but you're absolutely right. You never know how devastating a mutated virus could be. So the best thing the country has been able to do so far is, as you know, even the kind of when people travel into Nigeria, the situation is restrictive, which is a good thing to do. So the government has been able to do as much as it can, but you're absolutely right. You never know how it will hit us, and we've seen much more stronger countries being devastated. So we just have to be vigilant.
Well, you are the one in charge of the vigilance, it would seem. When you look at how much attention we've paid to COVID, it would seem to the detriment of other diseases. Would you say that, I don't know if this is for good or for bad, but how would you say it is also affecting attention being paid to other diseases that could crop up? Right now, what we seem to be expecting is a third wave of COVID-19. But do you think that there are other threats that are looming, which we might miss as a result of our attention all on COVID-19?
Yeah, thanks, Mark. But I think there's no doubt about it. In the first few months of the response, because of the intensity of the response, a lot of other diseases did suffer. But we are catching up, and actually some response to some diseases like HIV actually improved during the outbreak. We're able to get more people into care. I think the key challenge for all of us now in the health sector is to also use the opportunities that have come into the sector. You know, through this response, we've built up an incredible supply chain architecture. Testing, like Mo said, we still test 40 to 50,000 people every single week, even now. You know, we've built up this series of labs, not only for COVID, they can serve many other diseases. So there's a real opportunity for the health sector. People have realized, governors that never had health on their political agenda now do. So how do we, you know, leverage this to make sure that we use the resources to build up a sector that can work for COVID, but will also work for TB, HIV, chronic heart disease, whatever else that really affects our people. And that's really the challenge for the leadership of the health sector moving forward.
Well, gentlemen, we have to thank you for your time this afternoon. Dr. Chikwe Ihekwazu is the Director General of the Nigeria Center for Disease Control. And we also had with us Dr. Mohammed Yahya, who is the resident representative of the United Nations Development Program here in Nigeria. Thank you so much for coming on the program. It's over now to you, Ijoma.
Thanks a lot for that, Mark. But indeed, very frank and fruitful conversation that we are having as we reflect on Nigeria's COVID-19 response. Conversation still continues with me, and I have here with me in the studio the Country Director of Farm Access, Mrs. Njide Ndili. Thanks a lot for joining us on the program, and I know that you've been listening, and you're going to tell us what your contribution has been as well. I also have the former National Coordinator and Co-Chair of the Presidential Task Force, Dr. Sani Aliyu, joining us there via Zoom. Dr. Aliyu, thank you for joining us on the program.
Thank you for having me.
Fantastic, thank you. And then over in Abuja, I have the EU Head of Cooperation, Ms. Cecil Tazin Pelza. Thanks a lot for joining us on the program as well. Well, we will talk to them shortly. But let me just start the conversation with you, Dr. Aliyu. Yes, despite the numbers going down, I mean, that's what we've seen now. Let me just start by asking you what sort of a task it was, because at the time it was called the Presidential Task Force, now the Presidential Steering Committee. What kind of task was it for you responding, looking back now, months later?
Well, I think, as my brother Chikwe earlier said, it was very challenging at the beginning. And it was challenging not only for the leadership, the people involved in the response itself, but also the populace. We were faced with a virus that was quite novel, an epidemic that had not been seen, certainly in our generation, at all. And with a country with a fairly fragile health system. But I must say, Nigeria really needs to congratulate itself in the way the response was driven. It shows that we do have the capacity to get things right if we really put ourselves to it. And we must also acknowledge the importance of having good collaboration, multi-sectoral approach, and multilateralism as suggested by UNDP. To me, it was an experience that engaged not only at the federal level, but also at the state level, and our donors and the private sector. And I'm sure a lot of Nigerians are not aware of the crucial role played by people that were outside the government setup in dealing with this pandemic, especially COVID and the UN system. We were able to leverage on the efficiency. We were able to leverage on their ability to deal with urgent situations in order to intervene. I remember when we had the problem in Kano, for instance, where we had what looked like a major outbreak of COVID. The federal government, certainly the PTF, I don't think we spent very little from the government side. Most of the spending came from our partners, COVID, the UN system, particularly WHO, Dangote, the banks, etc., as well as a few government entities like INEC. They came together and we worked together to sort out what was clearly a very difficult situation in Kano. And I don't think that's ever been seen before. And from the state government side as well, the amount of collaboration we had with the state governments was huge. We were having meetings virtually every week to 2 weekly with state governors through the committee that Governor Okowa led, as well as having meetings with the international community. A lot of the decisions we took at the PTF level and reflected some of these collaborative approaches. Most of the decisions actually didn't come as a surprise to the people actively involved within the response itself. And we had a huge team of academic people, both from Nigeria and from the international community, that were providing us with a high level evidence base. Some of the decisions we took, particularly as it relates to travel, for instance, was subsequently replicated by a lot of the European countries. And I can remember when people started arguing with us at the beginning, why were we testing at day 7 and still test when people were coming into the country? But look at where we've now found ourselves. Virtually most parts of the world have copied this. And this just demonstrates the efficiency of our response, mostly through the leadership that we had. The fact that Mr. President himself really gave us all the support we needed. The message that was coming out not only from the leadership at the presidential level, but also from the state governors, as well as our traditional rulers, leaders within the community, and the PTF itself was very clear. This is a problem that needed to be sorted, and I'm really pleased that as a country we have delivered.
All right,
Having said that, though, it's definitely not over yet, and we shouldn't relax. It's not a reason for us to relax.
Yeah, I'll come back to you on that one, but let me just ask the country director of Farm Access now, because I know that you were part. I mean, your organization is part of the collaboration we're looking at. Just looking at the way the health system was structured and the challenges that we had, what aspect were you able to key into when you were brought on board to say, we have a crisis, what do we do?
First of all, let me say thank you for having me here. Just to mention that Farm Access Foundation is actually predominantly supported by the Ministry of Foreign Affairs of the Netherlands. So our work here is actually providing technical assistance to the government and state governments of Nigeria to build capacity and technical assistance towards healthcare systems. So already we were in Lagos, which is the epicenter, as well as several other states in Nigeria. So it was very easy for us to already key in. So a major objective in Nigeria is making health markets work. And what I mean by that is finding solutions that would enable the population access quality healthcare services, and with a focus on the bottom of the pyramid. So we look at the demand side, which is access through insurance. We look at the supply side, which is quality healthcare system through the hospitals, strengthening that system, then also, doing research to, kind of document that our innovations work.
That must have been very tough during the pandemic last year, because obviously many people said they didn't even have access to testing. And when eventually they did get tested, getting access to the result took ages. So how were you able to shorten that, the waiting time when, it was critical that people knew their status?
So first of all, I have to step back a bit to say that we were involved in several activities. Okay. Because we were already in Lagos State, which was the epicenter. So the first thing that was done was we became very quickly part of the governor's COVID strategy think tank to help develop the strategy to combat COVID. And with that, we realized that there had to be private sector involvement, even though we support government. But we advocate for private sector involvement. So we actually did the landscaping to identify private labs that could quickly scale up to increase the testing. Of course, there was all these complaints about 1 week before if at all you got your test result back. So we identified some labs, and Lagos State very quickly contracted about 7 private labs. And we extended that support through the UK government to actually NCDC. So I know Chikwe, if he's still there, was very aware of the support we were giving, trying to help scale up in accreditation of private labs. So that was one of the major interventions, bringing private sector on board to scale up. But also, we were involved in quite a lot of trainings, webinars. Of course, during COVID, because of the social distancing, there was the upscaling use of technology. So we leveraged on that. We developed a very innovative application called Lucy at the time, which helps you monitor the COVID symptoms and then triages you to a contracted facility. We had collaborated with FMC Ebutemeta, which provided free testing with the help of NIMA, which is Nigerian Institute for Medical Research. So they will test you, and if you're positive, you're admitted and you're treated for free with the support that we were giving at the time. So not just that, even supply of PPEs. We collaborated with Novartis to supply PPEs to over 23 public facilities, because they were the ones predominantly seeing the COVID patients around the 6 geopolitical zones. So there was a lot of activity just trying to support the efforts of the government, but from the private sector side, and making sure that they were targeted. We even, as much as, used that opportunity to promote health insurance. As you know, the people say by act of God, we were not, even those that got COVID were not very sick. So why can't we use this opportunity to talk about health insurance, to upscale the uptake of health insurance? So with that, we actually supported both Lagos and Kwara State to launch their mandatory health insurance program. So a lot of work went in to support the states. We also supported HEFAMA. HEFAMA is the Health Monitoring and Accreditation Agency of Lagos State, to find a way to accredit private hospitals to care for COVID patients. One of the hospitals that was admitted was Palom Memorial, which is now, very famous because of their COVID center and the number of people who they have treated. So we're very happy with the support we were able to give. And we're, gearing up and trying to see how we can support in the event. We're praying it doesn't happen, that we have a third wave.
All right, we'll hear more about the support you're giving. But let me just move quickly to the EU head of cooperation over there in Abuja, Ms. Cecil Tassin-Pelzer. And I'd like to just ask quickly, I know we're talking about the collaborative efforts and what was done in terms of the response, but many people's minds have moved to the response in terms of what's being done to ensure that vaccination happens, at least in this part of the world. When we were looking at the figures, we do see the EU contribution there to the COVAX facility. And, are you impressed with what you're seeing in terms of vaccine equity in this part of the world?
Good afternoon, and thank you for the question. Well, as you know, the European Union indeed has intervened at many different levels, so global level, regional level, and national level as well. And you are talking about COVAX, so yes, which is our intervention at the global level. Indeed, the European Union is the main donor of COVAX. We have secured 3.2 billion euros to COVAX to give better access to low and middle income countries to vaccines. In Nigeria in particular, the first batch of COVAX vaccines arrived a few months ago. I think it has already been said today that the distribution went well. Is almost, I think, is almost now secured, finished, and of course we are all waiting for the next arrival of COVAX. We are all the partners, and in particular the European Union. We are all putting all our efforts and also, let's say, diplomatic pressure to make sure that this COVAX facility is going to really reach the results that we all expect, and we have put our confidence in it, and we are all pushing. But as you know, there are also some constraints of access, because for instance, because of the heat wave that has hit India. But we are all waiting for better results soon. Yes.
I don't know if you would like to shed a bit more light on what unique collaborations you initially had to come up with. I mean, apart from COVAX, which is now the obvious one. And we know that the European Union, from what was said earlier, donated 50 million euros. That's a huge sum of money. What areas are you looking at targeting those monies at that you thought were in deficiency of in Nigeria?
Well, so in Nigeria, well, first, as I said, the European Union has also intervened at national level. So in each country where we have intervened, we have really looked at the national context. So we had different interventions from one African country to another. And in Nigeria in particular, we were lucky that the conditions were met for having multilateral intervention. And because we had all this national response plan, and we had all the national authorities which went together, all the United Nations agencies being coordinated by UNDP together, and all the different partners. So we were I think we had the best scenario in Nigeria, and the response plan was really multi-sector with all the different pillars that were addressing all the challenges. So this is why we have chosen to go through this channel, because we could address at the same time all the different challenges.
When you say we had the best case scenario, what did you mean?
But I mean, because there was this grouping, I mean, this joint effort that all the stakeholders, so not only the partners, but the Nigerian authorities, also the civil society organization, the private sector, around a national response plan. So there was, I mean, yeah, I say it's the best scenario, because in other countries there was not necessarily this possibility to come together very quickly. There was a very rapid mobilization here. It was, for instance, the European Union managed to mobilize this 50 million euros for Nigeria in only 3 months. Believe me, it's a record for us. But because the context was there. And so, yeah, I think Nigeria, we have been lucky to intervene like this in a context like in Nigeria.
A few things we tend to underestimate, Ijoma, and it's a very good thing we're sitting back to look at some of the strides that we made even in that time, because oftentimes we just tend to think that, oh, we don't have a lot in our country when it comes to health, but sometimes the ability to be able to mobilize, which we leveraged heavily on during the pandemic, is definitely something to say, okay, well, maybe we can do this again, assuming such a situation should come up. I'm just a little curious. When we look at how, countries were scrambling, because resources were money was not exactly a problem for many countries, but to actually get the things that were needed, such as PPEs and masks and, all the things that have been enumerated by our guests, were quite difficult then, because a lot of countries were scrambling for them. At some point, there had to be regulation on the types of masks that, ordinary people should be able to wear and what should be reserved for medical personnel. How easy were some of the things that, that our guests have enumerated in Lagos? How easy was it for them to be able to put Nigeria on the front burner to be able to get some of these things which we were lacking in-house?
I think, Markwe, that's one of the questions we're going to have to ask the former PTF chair. He is with us here on Zoom. But one of the important things that I got from the conversation was that moving ahead, a targeted approach really will be the best one, rather than trying to do it all. But now that we're moving and learning from that response, what should be the approach in terms of what should we target? And that's what I'm going to ask you, Dr. Aliyu, very briefly before you leave us. How much work still lies ahead? Quickly.
So thank you. Just to clarify, I'm actually not the co-chair. I was the national coordinator for the Presidential Task Force. The SGF was the chair of the task force, which has now transited on to the Presidential Steering Committee. I think there's still a lot of work that needs to be done. We've certainly learned our lessons. You cannot go through such an experience without learning something that's useful. So, for instance, the issue of messaging really needs to be critical. If I was to do anything different, or my colleagues were to do anything different from the PTF side, it would have been to really invest properly in risk communication and community engagement. When we started this, our approach was very clinical. We went quite rightly so towards the issue of making sure that we had enough PPEs, making sure that the hospitals were prepared, working with COVID to open treatment centers, etc. But what really became the weak part of the entire response was our inability to get the public to really believe in what we were saying. Mm-hmm. And it's partly because the public already have people that they believe in. Our religious leaders, our traditional rulers, our community leaders. And at the beginning, that message was really not coming through them. In other words, the message was right, but the people delivering the message were not really the right persons. And I'm pleased to say later on within the response, by August, September, we started shifting towards more closer engagement with communities and civil society, etc. So we've definitely learned from that, and I believe that will continue to influence the way the vaccine program is being delivered in Nigeria. Secondly, in terms of funding, although I've noticed a few errors that you put, so for instance, from the health side, definitely show that the federal government did not invest 450 billion naira into the COVID response from the health side. No, it was a very much smaller fraction that actually came to health. But nevertheless, the federal government did put in per capita, really, it was a significant investment. And we need to make sure that those assets that are now available, not only from government, but also from the private sector, from the UN system, etc., are put to good use. So, for instance, the treatment centers that have, some of which have been disbanded already, we need to really ask the question, what are those assets, where are those assets, and where are they being used? And the same as well with the oxygen plants that will now be put up in all parts of the country. We need to make sure that we maintain these facilities because they're really important parts of the health system. And it will help us in the long term if we were to come into this situation again.
All right.
But
okay,
again, I would say it is not over yet. And I'll really encourage Nigerians to continue to use those non-pharmaceutical interventions. And for those that have access to the vaccines within the current period that we are in, make sure that you're vaccinated. It's the best way to protect yourself. Thank you.
Thanks a lot, Dr. Alawi. We're really rushing, so you have to be very, very brief. He talked about what the weak aspects of the response were. From farm access, remember I did say that a lot of people complained. What are the weak spots? Really quickly, because we really need to dash. Moving ahead now, what are you going to do differently?
So for us, I think the weakness is that there was a lot of investment in temporary structures. If we are taking the funding that was mobilized from private sector to strengthen existing infrastructure, especially at the primary healthcare level, we would have gone a long way to be able to reach more people within the community. And the focus on health insurance is very key.
All right, so for this part of the conversation, I'm going to have to thank over in Abuja, Ms. Cecil Tazil-Pezda, that's the EU Head of Cooperation. I'm also going to thank Dr. Sani Aliyu, former National Coordinator of the PTF, now the Steering Committee, and also the Country Director of Farm Access, Mrs. Njide Ndile, for their contributions here on the program. It's not over yet. We still have to look at how we can build back better. We've looked at the response. We looked at what we've done. Now, how do we build back better, more permanent structures? To stay with us as we talk about it.
Sustained testing in states has decreased positivity rate, as we see. And the trend in reduction compares with global observations of a seeming decline in COVID cases, signifying that the second wave may be receding. We are, however, not drawing any conclusions at all, and certainly not declaring any victory, but rather we are watching developments as they unfold nationally and internationally, ready to make use of any comparative advantage that may emerge. In the meantime, there is no room for relaxing in our public health measures of wearing masks, social distancing, and respiratory hygiene measures. We are intensifying the monitoring of treatment of COVID-19 positive cases, especially those that can self-isolate, by strengthening and improving the capacity of personnel to manage home-based care. However, I wish to emphasize that those on home-based care must report to their hospital or case manager immediately they begin to experience symptoms or feel that their symptoms are getting worse. Experience has shown that COVID-19 disease can deteriorate suddenly and rapidly, resulting in life-threatening severity that could be managed if presenting to hospital early enough.
The global oil and gas industry is going through complex transitions that require our collective resilience to survive. Global business landscape is fast changing to accommodate the new normal advanced by the COVID-19 pandemic and the associated global economic impact. There are many things that will never come back to normal that we know again. And this, of course, has impact on everything, including leadership. Corporations have responded and are still responding to these shifts with a variety of unpopular measures, ranging from staff layoffs to salary cuts, in order to keep costs as low as possible and survive in these difficult times. The NMPC, now I'm speaking as a GMD, is definitely not immune from those global impacts, and we have taken careful steps to realign our business portfolios and operations to ensure continued value realization while deliberately preserving our employee as our most critical asset.
Right, welcome back. We're still looking at reflections on Nigeria's COVID-19 response. We're moving really swiftly now into the area of lessons learned. What can we do differently, seeing that this isn't over? You hear some people say, oh, COVID is over. No, it isn't. And we're looking at what lessons can we learn from the entire experience. Now, joining me to discuss this particular aspect over in the Abuja studio, I have the UNICEF Deputy Representative for Nigeria, Ms. Rushman Murtaza. Thanks a lot for joining us on the program. Good to see you. Right, and over here I do have the Divisional Head, Education and Health, Sterling Bank, Mr. Obinna Ukachukwu.
And happy to be here.
Great, thank you so much. And the Managing Director and CEO, Aliko Dangote Foundation, Mrs. Zoera Yusufu. Thanks a lot for joining us on the program.
Good afternoon. Thank you so much.
Great. So let me just start off with you. I know you've been listening to the conversation, and when we're talking about the UN Basket Fund, the One UN Basket Fund, and the donations from your foundation, we saw quite a figure there. Just what do you think we should do differently in terms of how the response has been, and for partners like yourself who have put in quite a bit, looking at what the response was, what would you say?
So my biggest takeaway, and what I think we should continue to do that we probably haven't done as much in the past, is really partnering with the private sector. I think there's this perception that the private sector isn't open or interested in issues relating to health, but that is absolutely not the case. And the fact that COVID has made such an impact, I was very happy to hear all of the previous panelists referred to the work that we were able to do over the past year. This was 100% of a private sector effort. The biggest banks, the biggest manufacturing companies, all coming together and contributing a lot of money to make sure that we could quickly bring a response to the COVID pandemic. And so, hearing Dr. Sani Adiu and Dr. Chikwe and my brother Yahaya thank us for contributing makes me feel good, because there was a lot of work that we were doing last year. But I do think that the biggest lesson for me is that the private sector can absolutely be mobilized and can make a significant difference very quickly. And I think this is one of the things that we need to continue doing and that we should take going forward. And it's not just to partner, to come together as a private sector and contribute money, but it's also to partner with other development institutions, other foundations, other private sector players to really bring to bear how the private sector works on making a difference in the challenges that we face.
Let me just ask you quickly before I go to Mr. Ukachukwu. Yes, you said it's not just about bringing money together, but I know a lot of donations did come from your end and from other partners in terms of palliatives. And then we saw the visuals that we saw about what will happen with distribution. That was a sore point, and maybe something or someone dropped the ball at that end. What would you like to see done differently in the event that partners come together again to donate, either food items or finance? What would you like to see done differently to ensure it gets to the destination that was intended?
Right. So, one way to look at the way the palliatives story unfolded that we weren't happy about, but the one way to look at it is to say, the ultimate people that we were trying to help, so the neediest Nigerians, are the ones who ended up getting those palliatives anyway. Clearly, this is not how we wanted them to be distributed. That wasn't the plan. But, what happened. And, blame is not, this is not the platform for blame. But in terms of what we could do better is really spend more time doing the actual distribution. What's really difficult? Of course, hindsight is 2020. But when you're in the heat of the moment and people are hungry and the stress is in the system. People have been locked down for weeks. We ordered food for 10 million people. This was the largest ever food intervention that's been done in decades here in Nigeria. Just the logistics of getting it done was gigantic and overwhelming. And I think part of where some of the challenges came in was, between the delay in getting all the stuff manufactured, bagged, tagged, transported across the country at a time when, remember, the roads were closed. We had to get special permission from PTF to be able to move the trucks from different parts of the country to other parts of the country, whether it was delivering rice or gari, getting, Tolerant to actually make the Indomie noodles and make 2.7 million cartons of Indomie. It was just a huge undertaking. And I think that the time that it took from manufacturing to distributing to actually getting it out to the people contributed to that. So maybe one of the lessons is, let's do it in smaller chunks. So let's do smaller palliative interventions so that we can, manage the process from manufacturing to handing it over to the ultimate beneficiaries.
Okay, fantastic. Thank you so much. And let me take that now to Mr. Ukachukwu, Divisional Head, Education and Health of Sterling Bank. I know you being one of the partners as well. Yes, you're going to tell us about what you've done, but lessons going forward.
Thank you very much. I think the major lesson going forward is not dropping the lessons that we learned. Going through during the pandemic, we found out that there was, call it, somewhat enough resources to get us to our feet, to put up the isolation centers, to distribute drugs, to support people generally. Monies that were hitherto were not in the system. That tells us that the only way to create a sustainable healthcare system is to pull monies from different sources. The answer is insurance. Now, that was an example of how people that were not sick brought the monies together, you can call them corporates or individuals, to solve a health challenge. That's just a micro example of what health insurance is. If we do not learn that the only way to create a sustainable health system is to be able to pool funds together from people that are well to solve our health challenges, then we're not going anywhere. So I think that the major lessons for me and for a lot of us is that we should keep pushing for our system, the country entirely to adopt health insurance. It has to be mandatory. I know the law is being reviewed, the act is being reviewed. It has to be done quickly. And that brings me to my second point. When it is done, we have found out that one of the best ways to spend money in healthcare is to spend at the point of use. I'll give a pure play example. Today we have over 100 PCR test centers, just from 5. You'd ask yourself, how did the private sector players, why did they commit their capital into that investment? Why? Because people were going to buy it, because people now had to do tests. They were traveling, they had to do tests.
Okay, I know we lost Mr. Ukachukwu there. I know we're going to try and get him back, but let me just swing this over to you, Mark, to continue from where we are now.
Well, thank you, Ijoma. As you rightly introduced, we have Ms. Roshnan Murtaza here, who is of UNICEF. I'm sure that it was a big relief for you to know that children were not the demographic directly affected by COVID-19. However, there were effects for children because schools were on lockdown. How big a worry was that for UNICEF, considering all the other indices that you also have to grapple with? I mean, for children, malnutrition, the fact that, this will also have an effect on, the livelihoods of people, and they'll be locked down at home. What was the thinking of UNICEF at that time?
No, thank you very much. And first I want to just say that it was very rewarding to hear the partnerships that was around in the response of COVID-19. Of course, for children, it has been a concern that whether the children are affected or not, but they are impacted because they are living in a household which are affected, the parents are affected, and then to the worst was, as you mentioned, the schooling. And but I think one of the things that we were really, we had to speed up our response, and sometimes to turn the challenges into opportunities. In the sense, we've been talking about the digital divide for a long time, but I don't think we had put our efforts together to really respond at how do we minimize that. And this gave us an opportunity, and the general public and the government and the private sector, to think beyond the way we think, to think beyond just education in the schools, to think beyond that how families go back to the communities, the families who played a role in education. So that was one part of it that we had to really put the response together. At the same time, it pushed us to broaden our partnership to private sectors and others, not necessarily only for resources, but business partners, to look at how do we translate this education materials into different contents, online and offline. And for offline, how do we, give this information to the most vulnerable? And that's where, once again, I think we appreciated the role of radio. It's a traditional media, but then radio played a huge role in taking that content out. Young people and as volunteers in the community played a huge role. So I think it was, in retrospect, I would say that this emergency actually pushed us to think beyond what we've been thinking and thinking out of the box.
Which is a good thing, but then the divide still remained. I mean, the fact that those who were vulnerable, it became even more vulnerable. Even around the middle classes, who a number of people would say are not as vulnerable as the most vulnerable, there was a lot of stress, because some parents were complaining about the fact that, they had to work, those who still had work, still had to, leave time to educate their children, and they found that a bit stressful. Have you been able to measure, have we been able to do that at all, at any level, the impact that this had on children, both emotionally, the fact that a lot of them couldn't go outside to play during the lockdowns, and have had to adapt differently to, what children would normally do. Have you been able to measure emotionally, educationally, what impact the coronavirus had on them?
So I would start by saying that, to measure an emotional impact is not an easy thing, yeah?
True.
But whether we are putting systems in place and whether we are recognizing that there is an emotional impact, I think that is what was most needed. So in that case, that we have been, more expanding the psychosocial support on one side, and on the other side that, what the stress the parents are facing, and that is why we were trying to get the community much more engaged, so that the community, because Nigeria is known for community support, and to fall back on that support to see how they can be supported. We also have, as UNICEF, we have what we call the U reporters. So we have 3 million young people as U reporters. So we have been, making a lot of polls. We've been working with NCDC as well, and we were trying to get how we connect young people, how we connect to share, because there is not much, because you are on one hand trying to respond on the routine, I would say services that the children need, because that was affected, because we were focusing more on the response for COVID. So I think it was a combination, but what I would say, it came at a very high expense, but it also woke us up to think again differently.
How have we been able to leverage on the gains that we have made from the opportunities that came up from COVID?
So I would say, one, as I said, that education definitely is it's not going to be the old education anymore, that only trusting the school system. Of course, it is important, but very much on online and offline education will continue. The other thing that I would say is the integration, because while we used COVID on protecting from COVID, but we integrated hand washing, and it would go a long way, going forward. And sitting in this, particularly this session with private sector, I think the partnerships that we have experienced, the government has experienced, the people have experienced, that would go a long way as well.
Well, thank you so much, Ms. Rashna Murtaza, who is the UNICEF Deputy Representative here in Nigeria. It's over now to you, Ijoma.
Thanks a lot, Mark. But yeah, quite insightful there as we look at this issue. But we have Mr. Obinna Ukachukwu back now. He went off earlier, but we have you back. Just quickly now, I know you were trying to make your point earlier, but my question to you is, how can we sustain the gains that you were talking about? The gains from partnerships from organizations like yourself, and just the collaboration with the private sector, the humanitarian and the development partners with the government. That critical success you were talking about, how do we sustain that quickly?
Okay, first and foremost, we've all got to realize at the back of our minds that health has economic and social imperatives. So it's a social good, but it's also a business. Now, if we do not think about interventions and health care as a business that has to be sustained, then there is no way we can continue this very good and effective marriage or relationship between the private sector and the public sector. I know before I went off, I tried to allude to the fact that the reason why you've seen private capital go into the development of labs is that there is a market for it. And that is exactly what will happen, the development that will happen in our health space when people that are sick can pay for it through insurance. People will now commit their capital into developing these facilities. I always argue that from the government perspective, the sector that really deserves subsidies when it comes to cost of capital is health. I don't even mind if we have a scenario where there is a 0% intervention support for health sector development. There is something else we really need to look at if we must sustain our gains, and that is the health workers. I remember that when COVID, at the turn of COVID, there were a lot of interventions around the infrastructure, the sick people, but we really didn't look at the health workers. Meanwhile, the world is a global village. Everyone in the world wants our doctors. What did we do at the time? We supported Sterling One Foundation to pay hazard allowance to health workers. We're paying them 100,000 hazard allowance every month, and we had about 154 people in our books. Now, when we interviewed them, we found out that it went so even beyond the monies, the fact that they were recognized. I think that is one aspect of our health value chain that we all need to sit down and say, hey, how do we sustain our human capital here? If we do not sustain that, there is no way we can sustain the wins that we've made. And there's no way we can sustain this partnership, because at the end of the day, who will serve, who will offer these services? So two major things, an emphasis on the health workers. They are the ones that can sustain this whole system. And secondly, an emphasis on pulling funds together. That is insurance. We've got to find a way to pull funds together to ensure that this whole system is funded. I'll give an advice or something I've observed. Usually when there is, we vote in monies for intervention in healthcare, it quickly goes into infrastructure, goes into buying of beds, building of primary health centers. But at the end of the day, these primary health centers are empty. Why not it go to the front? Let's tell ourselves, stop funding the infrastructure. Let's fund the service itself. Because when we fund the service itself, it now goes into the chain. And we're doing something about this. We've tried to partner with institutions to float a health insurance scheme where we're telling people, come and test it. You don't need to pay. Just test it and see it works before you start paying. Because we believe that movement has to happen.
All right,
else we can sustain anything. Thank you very much.
Thanks for that contribution, Mr. Ukachukwu. And Mrs. Yusufu, you heard him there talk about two critical things to sustain the gains, health workers and then pulling funds together. Is that the same for you? Do you agree with how we can sustain what we've started rather than everybody fall back in the event that COVID is out?
I think it's very important that we continue the investments that we made. Dr. Sani Adu said something earlier about, the equipment that we purchased for the 39 isolation centers that COVID set up. Most of those were actually in existing facilities. And that was because we were working with Dr. Sani and Dr. Chikwe to really guide how the COVID investments were going. So in terms of tents, in the very beginning, we probably did a couple of tents, but then 90% of the other ones that we did were actually, redoing a ward in an existing facility. The one that we built here in Yaba in Lagos is a permanent facility. We're actually using it right now for vaccinations, et cetera. So it's been, very well utilized. So yes, the investments that we made need to stay for longer, right? This was an opportunity for us to have an even bigger intervention on the primary healthcare space. But I also think it's very important that we leverage more philanthropy dollars. For instance, what my fellow panelist was saying about the labs and people wanting to make money, we purchased 2 labs as Aliko Dangote Foundation, not even through COVID, took them to Lagos, bought all the supplies because we wanted to contribute to making sure that enough people had the ability to be tested in Kano. So there's money that can go for the greater good, and there's money that goes for business. And I think both are completely legitimate, and we need to support both of those interventions. But doing things for the long term in the middle of a crisis, I think is a huge opportunity that we cannot lose. Not to say that, another wave is coming or another pandemic is happening, but I think just for us to be ready. Now we know what the gaps are in the system. Now we know what kind of partnerships we can have. Now we know the organizations that are on ground and that we can mobilize very quickly to get resources and results. And I think this is what we need to keep building on as we strengthen our healthcare system in Nigeria. I mean, the biggest lesson, I think, for us is that there was nowhere for us to go. Like, even rich people were stuck here in Nigeria because the world was shut down, and the situation abroad was worse than what we had going on here. So, seeing overcrowded and overrun hospitals in the US and in Europe and in Asia, when we still had a manageable situation, just made it obvious that there was nowhere for us to go. The big story now that we need to be working on is how do we start making a lot of these commodities that we imported. All the testing supplies, the struggle with testing supplies, having to sign with the UN to be in the basket fund so we could get testing supplies in Nigeria, all the drugs that we had to import because they're not made here, all the pharma equipment that we had to buy for the isolation centers, none of it was made here. A lot of the PPEs we had to import, right? So I think the opportunity for us to focus on investing more, so to piggyback on the private sector investment argument, is let's be investing in healthcare related solutions for us as investments and as business, because this is what we're going to need. We're now going to be able to rely on other people sending us supplies much longer.
All right. Thank you so much. Managing Director and CEO, Aliko Dangote Foundation, Mrs. Zura Yusufu. Thanks for your contributions there. And also to thank the Divisional Head, Education and Health, Sterling Bank, Mr. Obinna Ukachukwu, for his contributions as well there. So now we know what the gaps are, and we know what we should be doing going forward. We're going to take a quick break and expand the conversation on contributions really briefly before we wrap it up on the program. Do stay with us.
In terms of being able to curb or to prevent the third wave, we are carrying out this strategy alongst 5 pillars. The first pillar is to make sure that we keep our testing high so that we can pick up early any evidence of a third wave emerging in the community. In addition to that, if we find positive cases, and that's in the first pillar there, if you are positive, we're going to repeat your test, this time with another type of PCR that can detect the possibility of mutations. So we are equipping the Lagos State Biobank with the capacity to do 2 types of PCR tests. The first type is just to pick up a positivity, and the second type is to try and help us characterize that virus and put it into either one of the strains that we know are circulating around the world, from South Africa to Brazil to Europe and to India. In addition, we're using eco-telemedicine and what we call the eco-telemed platform to manage people at home. But more importantly, as people are arriving from abroad, which is the most likely reason why we might get a third wave, which is because passengers are coming in from exotic countries and they may be bringing along with themselves the mutations and the strains of the new viruses. Of course, the third pillar there is the standard hygiene principles and social distancing that we are all familiar with. We are imploring all Lagosians to stick to the non-pharmaceutical interventions of social distancing, personal hygiene, respiratory hygiene, and avoiding large gatherings which may turn out to be super spreader events.
COVID-19, a new strain of virus from the family of coronaviruses, has been recorded in over 200 countries, areas, and territories around the world. The highly infectious virus is transmitted primarily via droplets of saliva or discharge from the nose of an infected person through coughing or sneezing. These droplets can then be acquired by anyone in close contact through breathing in the droplets or by touching objects and surfaces with the droplets and then touching the nose, mouth, or eyes. While it's been said that some infected persons may not display symptoms, common signs of COVID-19 infection include dry cough, fever, sore throat or diarrhea, and difficulty in breathing. Do you or someone close to you have these symptoms? Call the following numbers.
Take some contributions and a number of partners who've also been part of this fight to make sure that the pandemic does not rage the whole of Nigeria. And let's start with the first contribution from one of the development and humanitarian partners.
Well, Dr. Kunle Onokoya, Lagoon Hospitals, thank you very much for putting this together. I think what we've learned has been very well documented by the panelists, but going forward, I think a couple of things to say.
Goodness.
Our website, channelstv.com, has more information on our top stories and others. Subscribe and watch Channels Television's live stream on YouTube and other social media platforms using your mobile device browser, or download the Channels TV app for Android and iOS devices from their respective stores. You can also watch us via your smart TV platforms on Apple TV, Android TV, Fire TV, and Roku. Channels Television, ubiquitous.
Welcome back. We're still looking at reflections on Nigeria's COVID-19 response. We've had a look at what we did right, what didn't quite go so well. And now we're taking a look at the lessons learned and moving forward, what to do as this pandemic is still with us, hasn't gone anywhere. So we have to be careful. Now let's take a few contributions from some humanitarian and development partners as well that are with us in the audience today. If we can have the first contribution.
Yes, Dr. Kunle Onokoya, CMD Lagoon Hospitals. First of all, thank you very much for putting this together. I think what we have learned is been very well expressed by the various panelists. And going forward, a couple of things to say. Particularly at the beginning of this, I think while the role of private funding was very well clear, with regards to relationship with government, the role of private healthcare wasn't so clear, and there was quite a bit of ambiguity as to where private healthcare stood with regards to what the government response was, and we were not quite sure whether we were on the same side or we were adversaries or competitors. And I think going forward, as we plan for the next pandemic, really, it will be good if private healthcare is part of that planning and the roles are very well defined and very well clear. Secondly, one did hear Dr. Yusuf say that at least from the learning point of view, we now have oxygen centers all over the country. Now that is good. It's just that we don't know what is going to be needed for the next pandemic. And preparing for that needs to be a 360 degrees approach. Nobody knows whether it's going to be blood transfusion and blood products. We don't know whether it's going to be IV infusions. So going forward, it will be good if across board the healthcare system is strengthened and not just, now this one had to do with oxygen and ventilators and all. But really and truly, we don't know what the next one is going to require. Preparing for it will mean strengthening across board. Thank you.
All right, so he talked about the private healthcare contribution there and the 360-degree approach needed. I know the DG of the NCDC talked about a targeted approach, and when he's wrapping up, we'll hear which approach should be the best one. Let's take the next contribution.
So good afternoon, everybody. My name is Ololade Odukoya, the Chief Financial Officer at JNTI International. I just have a question, a simple question for Dr. Hiokwezi, and it's around vaccination. I know, as we talked today, that we haven't gotten to the end of the pandemic. What are we doing in Nigeria to ensure that we increase the number of population that are vaccinated as we attain herd immunity? And then secondly, what are we doing in terms of increasing awareness? Because it appears that everywhere you go now, people are not wearing their mask and people feel that it's over. There needs to be an increase in awareness. Just want to know what are we doing to ensure that we increase this awareness? Thank you.
Okay, but before he responds, I think we'll take all our contributions, and then when we head off to Abuja, he can respond, and then Mapwe can wrap this up really nicely. So let's take the next contribution while we hold that question for Dr. Hekwazo until we cross over to Abuja. Let's have the next contribution.
My name is Professor W. Adeyemo, Chairman Medical Advisory Committee of the Lagos University Teaching Hospital, Lagos. I represented the Chief Medical Director of the Lagos University Teaching Hospital. Thank you very much for putting this program together. My main comment is the experience that we had as a teaching hospital, a tertiary hospital in Nigeria during the pandemic. And I really want to briefly talk about the role played by the PTF, that's a Presidential Task Force, in terms of the leadership method that they use. One of the things that actually really, as far as I'm concerned, that one of the gain is the fact that PTF did not sit down in Abuja. They went around the country, and they were able to see that we have serious infrastructural deficit. And I think they got that message back to the president. And what we are seeing in our teaching hospital, and I hope that we are going to continue, is that we spend a lot of money in the last 1 year on our tertiary health care centers. And I sincerely hope that now that the executive, they are convinced that we have a serious infrastructure deficit, they will be able to convince the legislature that in the next 5-10 years, we spend more money in putting down infrastructure in our teaching hospital so that we can upgrade all our facilities. Thank you.
Thank you. So not just investing in health, not just funding, but investing in the healthcare sector as well to sustain the gains that we've already seen in terms of infrastructure. Let's just take the last contribution.
Good afternoon. My name is Dr. Olaokun Shoyinka. I'm a public health physician. I would just like to, well, first of all, to thank you for the program, and it's been very educative, very great to see the wonderful collaboration between government, private sector, non-governmental sector, civil society. We did this because we had an emergency. But I want us going forward to realize that we still have an emergency. We lose more people on a daily basis than we would ever have lost from COVID, from infectious diseases, non-communicable diseases, maternal deaths, trauma, violence, etc. We are in the midst of an emergency. So if we can speed up and take seriously some of these suggestions, like health insurance, in particular mandatory health insurance, which will help government inject money into the sector. And then with that money, we pay attention to what will take healthcare to the masses, that is primary healthcare. And the primary component of primary healthcare is the healthcare workers. So some of that injection of funds should go towards an emergency ramping up of our pipeline of the variety of healthcare workers that we need, all the different cadres, to provide that healthcare at the sharp end, at the grassroots level. So going forward, let us please remember we have a healthcare crisis in Nigeria without the pandemic. Thank you.
Thank you very much for reminding us about that. So, Makwe, I'm going to throw this back to you for the DG of the NCDC to respond to the question that we had from our audience member here on vaccination in terms of coverage. Makwe?
Thank you, Ijoma. We also have a few contributions here from our audience members here in our Abuja studio. So we'll quickly take that before we go to Dr. Ihekwazu. Yes, please, Dr. Agogo.
Yeah. Good afternoon. It's been a pleasure listening to the conversation. My name is Dr. Emmanuel Agogo, Country Director, Resolve to Save Lives. First question for Celine. I mean, Dr. Yaya talked about the precarious state of multilateralism just before the pandemic, and EU was able to weather that. So what were the key lessons learned going, from the whole experience? And then for Dr. Ihekwazu, one of the key things also that we've spoken about is about strong MPHIs, National Public Health Institute. So what are the key elements that you have seen that were critical to the response, and how can they be scaled up for the future?
Please go ahead, Ma'am.
Thank you. I really enjoyed myself, and it was really a reflection about the pandemic. So mine is a question to the private sector. Moving forward, we really appreciate the coordination of the private sector coming together. But moving forward, what are their plans in terms of support for the whole of the health structure in the country? Because, yes, COVID has come in, they have come together, but what's their plan for the future of health, support for health? And I also want to ask, because we have the vaccine production going in other countries, what's the plan of the private sector towards vaccine production? I think they need to look into that. Thank you.
Thank you very much, ma'am. So let's quickly take your response. Dr. Ihekwazu, you have the longest set of questions. I don't know if you'd like to start there.
No, thanks, Mark. It's been a fascinating conversation and very complex. The question of vaccine uptake, the first thing is really the government of Nigeria, through all its mechanisms, through the COVAX facility, through the African Union, is working very hard to getting more vaccines into the country. We're on a good path, but then the outbreak and escalation of cases in India happened, which took us back a bit. But every effort is being made to bring in more vaccines. Actually, there's been a lot of discussion on hesitancy, but uptake has been very good in states, and Nigerians have really come forward. We encourage them to keep doing this, to have confidence in this vaccine, in any vaccine that we are offering, whether it's the AstraZeneca or most likely the J&J vaccine will be coming in next. Really, to encourage people is the only way that will ultimately get us out of this need for masking, for not celebrating together, and to get back to some level of normalcy. I think Dr. Agogo asked about the components of a national public health institute. And, there are many things to that. I won't go into all the details, but I think for me, the biggest lesson, and something I want to draw out further, is, agencies are made up of people. And in this outbreak, many people talk about the Nigerian spirit, as if it's something out there that you can't touch and feel. I think in the last year and a half, I saw the Nigerian spirit in action. Whether it's in how the private sector came together, the UN, staff of my agency that worked 14 hours, 15 hours every day, 7 days a week for months. The collaboration with the states, people did over and beyond. And, it really gave me hope for the country. There's a lot of despair very often in Nigeria, but really the response, the energy, the ability to innovate, to find solutions where there's no precedence, to find a way of sustaining a supply chain. You would never, in the past year, no one has talked about stockouts of PPEs, or that a lab somewhere in Bayelsa or Zamfara has run out of reagents. We have kept this going. So it shows that it is possible. Most of this is being run by Nigerians. So really it is to make use of the energy, the efforts, the resources, just like Dr. Soyinka said, that we have deployed in a pandemic to make the rest of the health system and ultimately the country work better for all of us.
I don't know whether you would like to quickly respond to the role of the private sector, because I think someone raised that question about what their role,
He's absolutely right. When the pandemic started, we thought, like with most public health outbreaks, that we could do this with the public sector. But as soon as cases escalated, we sat down, and also credit to the presidential task force. We looked around and said, listen, Nigeria is actually known for private sector energy and entrepreneurship. So why exclude them from the response when we actually need them? So we opened up the space. We had to do it in a kind of regulated way because of the nature of the virus, to make sure that we don't expose more people to risk. We did that in the lab sector first, and then we did that in care provision, mostly around Lagos, and we have learned a lot. So what we're now trying to do is, use the learnings from the response and make sure, like he rightly said, we are much more strategic about this from the very beginning. Realizing our strengths in Nigeria, the private sector, no doubt, is one of the strengths we have as a country. And so we must really integrate them into our thinking much earlier moving forward.
Are we going to have a pandemic response, detailed out as a result of what we've gone through with COVID-19?
We definitely will, and we're looking at all our plans, but really like someone said earlier, no one knows exactly what the next pandemic will be. This was a respiratory virus that had certain needs. So if we go now and focus only on oxygen, the next time we might have an outbreak that requires dialysis, for instance, or requires a lot of blood transfusion. So we really have to be broad in our thinking. And that goes to the question, do we go narrow or do we go broad? We do both. And we can do that. But the key thing is to have the people that can think on their feet, have the resources to support, have the agencies like a National Public Health Agency like NCDC, with the resources, the capacity, the expertise to react rapidly And remember, no pandemic starts as a pandemic. Every pandemic starts as a cluster of 3, 4, 5 cases. So you need people that understand what could happen, can think ahead of the situation in front of you, and make sure you take the right decisions. And sometimes you take the wrong ones, and you learn from it and adjust and move forward. So, you know, I think we've learned a lot. The key thing now is also to keep our eyes on the ball and not to think, this is over, let's go back to business as usual.
Well, thank you, Dr. Ehekwazu. Cecil, do you want to quickly respond to the question on multilateralism and what lessons we've learned moving forward?
Yes, thank you. Thank you for the question. Thank you very much. Well, yes, I think first it has demonstrated that we are stronger together. On the European point of view, first, as the European Union, when COVID-19 crisis started, we have decided to come together, European Union plus European countries, what we call Team Europe. And this is something that was created for the COVID crisis, but that will go beyond. We will continue. In the Nigerian context, so as we said, you know, we have been through this UN basket fund, and again, I think this is one example that we can continue for other, and actually we are already doing it, for instance, for sexual and gender-based violence through the Spotlight Initiative. It's the same idea of the different UN agencies, different partners. So yes, I think it will, you know, those are very good examples that we can follow and go beyond. And of course, there are a lot of lessons for our future support to a country like Nigeria. I mean, as the European Union, there are already some ideas that we had, but which are even reinforced. Of course, the need for more investment in health, it has been said, but not only, also education, sanitation, the digitalization. We have talked about it with the school, the remote schooling, for instance. The need to invest more, I would say, in scientific research, research on infectious disease, to invest more in the industrialization as well, because we have talked about the problem of getting vaccines. We think that in a country like Nigeria, we could be able to produce vaccines. So this is something we are ready to help on this. And we have to look at the future, and you know, this concept of building back better, really to take this opportunity that we have to rebuild, to really at the same time tackle, to work at the same time on competitiveness, on environmental sustainability, and on social inclusion, all together, one for the other and not one against the other. And we really believe it's possible, and it's an opportunity to do it, and especially for young people who have to be really at the focus of all our actions.
Well, we sincerely have to thank you, Ms. Cecil Tazen-Pelzer, who is the EU Head of Cooperation here in our Abuja studios. We have to thank all of you contributors who have been here. We thank you, members of our audience, for spending time with us this wonderful afternoon and, you know, sharing your thoughts and your reflections on the COVID-19 pandemic and how it's affected not just your personal response, but also the response of your organizations and the lessons learned moving forward. As someone did say on this program, one of the lessons learned is that we should never forget the lessons that we have learned from this pandemic. And I think at the heart of it is our common humanity, and that we are truly stronger and better together. Over now to you, Ijoma.
Thanks a lot for that, Mark. And interesting to hear the DG of the NDCC talk about what we do going forward. Do we go broader or shall we go narrow? And he said we should do both. So that's really something we should think about, not just going broad, but also going narrow when we do need to. So it's thanks as well from my end, and for you to actually see the members of the audience that I have here with me. If you can give us a hand, because I think you've been a very nice patient and a very, very participatory audience as well. Thank you for that as well. So the pandemic hasn't gone anywhere. The virus is mutating in some societies, and it is adjusting in different environments to ensure it survives and thrives. But with our hands, partnerships and collaboration, we can ensure that we do defeat it, not just on this side of the world, but the rest of the world as well. Thanks a lot for joining us. I'm Ijoma Onyato, and stay safe and bye.